Do you ever drive when you've been drinking? Do you have to drink more than before to get drunk or feel the desired effect? Have you ever felt that you should cut down on your drinking? Have you ever had any blackouts after drinking? Have you ever missed work or lost a job because of drinking? And is someone in your family worried about your drinking? These are questions used by the National Institute on Alcohol Abuse and Alcoholism to screen for alcohol abuse or alcohol dependence. The definition of alcoholism is drinking alcoholic beverages at a level that interferes with physical health, mental health, and social, family, or job responsibilities. Alcohol can cause both physical and psychological dependencies. Those at risk for developing alcoholism include men who have 15 or more drinks a week, women who have 12 or more drinks a week, or anyone who has 5 or more drinks per occasion at least once a week. One drink is defined as a 12-ounce bottle of beer, a 5-ounce glass of wine, or a 1.5-ounce shot of liquor. The effects of alcohol appear within 10 minutes and peak at about 40 to 60 minutes. Alcohol stays in the bloodstream until the liver can break it down. If alcohol is consumed faster than it can be broken down by the liver, the blood alcohol concentration level rises. Only 15% of people with alcohol dependence seek treatment for this disease. Alcohol is a depressant and affects the central nervous system, which leads to a decrease in activity, anxiety, ambitions, and attention. Even a few drinks can change behavior, slow motor skills, and decrease the ability to think clearly. Alcohol can also impair your concentration and your judgment. Some symptoms of alcoholism include abdominal pain, confusion, drinking alone, episodes of violence while drinking, hostility when confronted about drinking, lack of control over drinking, making excuses to drink, nausea, vomiting, need for daily or regular alcohol use to function, not caring for physical appearance, secretive behavior to hide alcohol abuse, and shaking in the morning. Some of the serious complications include brain degeneration, cancer, cirrhosis of the liver, depression, heart muscle damage, insomnia, liver disease, poor nutrition, severe memory loss, and suicide. People who are dependent on or who use alcohol or who abuse alcohol continue to drink it despite physical or mental problems. They may have problems with binge drinking, which is drinking 6 or more drinks at one sitting. Those with dependence have more serious problems and a greater need to drink. Alcoholism is a serious social, economic, and public health problem. Alcohol is involved in more than half of all accidental deaths and almost half of all traffic deaths. A high percentage of suicides also involve the use of alcohol. People who abuse or are dependent on alcohol are more likely to be unemployed, involved in domestic violence, and have problems with the law. Alcohol withdrawal develops because the brain adapts to the alcohol and cannot function well without the drug. Symptoms of alcohol withdrawal may include anxiety, confusion, death, increased blood pressure, psychosis, raised temperature, rapid heart rate, seizures, or tremors. There are 3 different stages of alcoholism. In the early stage, a person begins to depend on alcohol to affect their mood. They drink for relief from stress and problems, and they begin thinking more and more about alcohol and drinking. The person and others around them may not even recognize that the person is in the first stage of alcoholism. A gradual increase in tolerance happens. It means that it takes increasing amounts of alcohol to achieve the desired mood effects. Often the person can consume large amounts of alcohol without even appearing impaired. At the early alcoholism stages, the body has adapted to increasing amounts of alcohol. In fact, how a person functions will likely be improved with drinking as the blood alcohol level rises. However, with continued alcohol consumption over time, the body begins to lose its ability to deal with high alcohol levels, as this occurs when the alcoholic stops drinking and their blood alcohol content decreases. Their thinking, talking, or walking functions deteriorate, and then they're moving on to the second stage of alcoholism. In the second stage of alcoholism, the need and desire to gradually drink becomes more intense and more important to the alcoholic. Drinking larger amounts and by yourself appears throughout the day. The alcoholic is losing control over drinking, and the body is losing its ability to process alcohol like it did in the first stage of alcoholism. Their tolerance decreases as they become more intoxicated easily. Withdrawal symptoms begin more. The person might now recognize that they have a drinking problem, and others may notice as well, but it becomes more difficult for the alcoholic to face it, and they don't know how much their alcohol can handle, or their body can handle their alcohol anymore. The last stage of alcoholism, the alcoholic has become obsessed with drinking to the exclusion of nearly everything else. Everyone can tell there's a major problem. During the late alcoholic stages, the mental and physical health of the alcoholic are seriously deteriorating. Many of the body's organs have been damaged, which lowers resistance to the disease, Relationships at home or socially may have been severely damaged, and there can be mounting financial and legal problems due to the alcoholic's powerlessness over alcohol. Every alcoholic will suffer from malnutrition. Alcohol in large amounts interfere with the digestion process and the passage of nutrients from the intestines to the bloodstream. Liver function has been damaged, furtherly limiting the conversion of nutrients into a usable form that the body can assimilate. The damaged cells are not receiving the needed nutrients, they cannot repair themselves, and the damage continues to worsen. If the alcoholic continues to drink, alcohol will likely cause the death of the alcoholic in one way or another, from suicide, accidents, and related injuries to direct damage to the body's organs and system. Death will likely be the final outcome at the end stage of alcoholism. Alcohol withdrawal can vary from a mild disorder to a serious life-threatening condition. Withdrawal symptoms usually appear within 12 hours of the last drink, and the symptoms peak 48 to 72 hours. Alcohol withdrawal symptoms can continue for as long as a week or more, and some symptoms include sleep change, rapid mood change, and fatigue that may last for months. Alcohol withdrawal should be considered a serious medical condition that can quickly become life-threatening. Some of the causes of alcoholism is it's a type of drug addiction. There's both physical and mental dependencies on alcohol. Alcoholism is divided into two categories, dependence and abuse. People who are dependent on alcohol spend a great deal of time drinking alcohol and getting it. Physical dependence involves a need for increasing amounts of alcohol to get drunk or to achieve the desired effect, which is your tolerance. Alcohol-related illnesses, memory lapses, withdrawal symptoms when alcohol use is stopped. The most severe drinking behaviors includes long drinking binges that lead to mental or physical problems. Some people are able to gain control over their dependence in an earlier phase before they totally lose control in the third stage of alcoholism. But no one knows which heavy drinkers will be able to regain control and which will not. There's no known common cause of alcoholism. Psychological factors may include a need for anxiety relief, conflict in relationships, depression, low self-esteem, and some of the social factors are ease of getting alcohol, peer pressure, and social acceptance of alcohol use. So alcohol is a very serious problem. So before you pick up that next drink, just remember you're hurting yourself and your health. That's about it.